essential because they are actually dispersed information. They make sure that everything which is said will be taken to the people, to the grassroots. And so we are happy they are here. If I have to introduce the ministers who are here, Vice President Ayu, yes. Sure. There is Honorable Professor Murgira, Minister of Higher and Tertiary Education, and there is right behind him, there is Honorable Professor Mutuli, our Minister of Finance and Economic Development. There is also Dr. Sekai Nzenza, Honorable Minister of Industry and Commerce, and there is Professor Madima, our Minister of Public Service, Labour and Social Welfare. And I see right behind there is Honorable Deputy Minister Mangwiro, Deputy Minister of Health and Child Care. The Permanent Secretary, yes, our Permanent Secretary for the Ministry of Health and Child Care. Welcome you this afternoon, Honorable Vice President, and I'm not going to take too much of your time. This is your time to speak about the strategy of the ministry. Honorable Vice President.
Thank you, Honorable Minister. Honorable Ministers, Permanent Secretary for Health and Child Care, Dr. Jasper Chiwenga, members of the press, ladies and gentlemen. I think every one of you has been waiting to say when are we going to talk. So this is the day. Ladies and gentlemen, Zimbabwe's vision is to have a national health care system that reflects international best practice by 2030. The desire is to have a national health care system that ensures that all members of the population have equitable access to health care services of sufficient quality, thereby leaving no one behind. To this end, His Excellency the President of the Republic of Zimbabwe, Dr. Emmerson Mnangagwa, ordered the restructuring of the Ministry of Health and Child Care for it to reflect international best practice. Today, it is with great pleasure that I announce that the first phase of the restructuring of the Ministry of Health and Child Care that I was tasked to undertake by His Excellency the President is now complete. The main objective of the restructuring was to achieve 1. Efficiency, 2. Effectiveness, 3. Integrity, as well as 4. Integration of the Ministry of Health and Child Care with the national institutions by removing insularity tendencies, limited or no coordination with the national institutions. The specific objectives were 1. To develop a new structure of the Ministry of Health and Child Care meant to achieve the above, and 2. To develop a funding model for the new structure as well as address conditions of service for health professionals. The restructuring of the Ministry of Health and Child Care followed 3 stages. The first stage was to augment the levels in the hierarchy of the national health care delivery system. The second stage was to develop and organize the strategic departments. The third and final stage was to develop and adopt a sustainable funding model for the national health care system and develop conditions of service for the health staff to drive the new Ministry of Health and Child Care structure. The Zimbabwe National Health Care System traditionally had 4 levels. 1, primary health centers. 2, district and mission hospitals. 3, provincial hospitals. And 4, central or quaternary or teaching hospitals. We have now added the 5th level or quaternary hospital, which is a high-level research and development hospital. The 5 levels are designed to result in an efficient and effective national health care system that produces and depends on high-level science in executing the health services. The new restructured Ministry of Health will now be composed of 9 divisions that are headed by chief directors, including 8 specialized departments. However, it must be noted that the total establishment of the Ministry of Health and Child Care has not been changed. The 9 divisions include the 1, research, biomedical engineering, biomedical science, biopharmaceutical engineering, and production. 2, general health service inspectorate. 3, logistics and assets management. 4, personnel and external relations. 5, human resource management. 6, health professional councils and regulation. 7, finance and corporate services. 8, public health policy, strategy and programs. And 9, curative services. The Ministry of Health and Child Care departments include 1, National Ambulance Service, both air and road. 2, Infrastructure Planning and Development. 3, Provincial Medical Directorate. 4, Central Hospitals. 5, quaternary or research hospital. 6, Public Relations. 7, Audit Services. And 8, Legal Services. In order to fund the new Ministry of Health and Child Care structure, it is important to understand the current situation. Currently, Zimbabwe has a national medical import bill that is high. It is thus imperative that Zimbabwe develop a method of containing the import bill through health care related innovations for import substitution. This entails inverting the import bill burden into export receipts, either in part or, most importantly, in whole. This will improve the funding of the national health care system. It is clear that the new Ministry of Health and Child Care structure is a productive structure that puts into effect the advantages of the triple helix model. The triple helix model entails the closed-knit cooperation system between 1, government, 2, private sector industry, and 3, higher and tertiary education institutions, with the purpose to innovate and co-create, thus bringing capability and excellence in the national health care system. To this end, the biomedical engineering, biomedical science, and pharmaceutical and biopharmaceutical engineering division have directors that are specifically responsible for the higher and tertiary and tertiary education institutions, and industry and commerce, respectively. This system is the one that Zimbabwe adopted in the fight against COVID-19 with much success. Based on the implementation of the new structure of Ministry of Health and Child Care, Zimbabwe's expertise in clinical services will be exploited to the full through the development and operation of medical tourism facilities. In addition, linkage of the Ministry of Health and Child Care with industry, higher and tertiary education innovation hubs, and industry and commerce shall ensure sustainable and reliable delivery of the required equipment and drugs in the health sector through local manufacturing. It is important to note that the restructured Ministry of Health and Child Care represents a complete change of philosophy which will put an end to the incessant problems that had dogged the national health care system for years. It is our conviction that most of the problems, if not all of the problems in the national health care systems, were a product of a wrong configuration. In the area of clinical services, when Zimbabwe manages to avoid patients' export or a patient referral bill alone through local treatment capability, we shall be able to make an equivalent saving. In other words, we can turn the logic around and aim for a medical tourism. In addition, considering that the country's medical supplies import bill is high, our hospital equipment manufacturing should be able to reduce this bill significantly. We are convinced that a new structure of Ministry of Health and Child Care shall make our national health system a net exporter in the short to medium term. We shall deliberately offer services that are also offered worldwide by other efficient health care systems through 1. Medical tourism and biomedical science services, 2. Biomedical engineering, and 3. Pharmaceutical and biopharmaceutical engineering. In addition, the situation of the institution of the Health Inspectorate, logistics and asset management, health attaches, and the legal services directorates is designed to result in savings by stamping out leakages in the Ministry of Health and Child Care procurement and management systems. On the conditions of service for health professionals, the Ministry of Health and Child Care new structure includes the Critical Infrastructure Planning and Development Department, which is key to the provision of accommodation for health professionals, among other infrastructure needs. Housing and vehicle loans will also form part of the improved conditions of service. Local manufacturing through the implementation of the triple helix model will ensure sustainable availability of personal protective equipment, PPEs, which had become a drain on the national foreign currency reserves. Finally, we have now reviewed salaries and allowances for health professionals as way of government commitment to make the national health care system competitive. To this end, an overall increase on health sector specific allowances will be effected by government. We are convinced that salaries and conditions of service are bound to further improve and be more competitive in the short to medium term because of the import substitution measures that the new Ministry of Health and Child Care structure is now representing. As we move forward and face the future with courage, the expectation of the government of Zimbabwe is that the work ethics and work culture within the Ministry of Health and Child Care undergo deep transformation. We expect all grievances to be solved amicably through discussion without endangering patients' lives. Never again shall patients' lives be used as pawns in a game of chess. Health professionals will now be expected to be true to their oath of ethics, the Hippocratic Oath. We also expect any demands to be made based on our national reality. As government, we commit to continuously review the conditions of service of our health professionals. Tatenda, Siabo. Thank you.
Thank you very much, Honorable Vice President and Minister of Health and Child Care. Here we are. He has given us step by step the national strategy for the Ministry of Health and Child Care. If we do have any questions, I hope it has been very clear and we have all understood it. And I want to thank you very much for listening to the Vice President and also Minister of Health and Child Care.
Yeah.
Thank you very much. Now you listen to the Minister of Finance and Economic Development, Honorable Professor Chiwenga.
Thank you very much, Chairman and Vice President. I just want to add 2 points. The first one pertains to supporting the production pillar in the strategy that was announced. And this mainly pertains to the pharmaceutical sector. That as government, will be working with the pharmaceutical companies to try to raise funding for their recapitalization and retool. We intend to approach development banks, really resident outside Zimbabwe, to raise this funding, so we're working together to support them. This will be an effort obviously involving the Minister of Health, Minister of Finance, and the parent ministry, which is Minister of Industry and Commerce. So that's one area. As you know, there was a point when we used to be very competitive in the pharmaceutical sector, exporting quite a bit to producing a range of products. And that demand domestically has dwindled, and that capacity has been eroded. We want that capacity to be resuscitated. We also want to make sure that we can then expand export growth. That's the first point. On the second point is regards to the SR review, and that has been mentioned by the Vice President and Minister for Health and Child Care, that indeed our intention will be to improve the conditions of service for the health sector, but also for the entire civil service, focusing on obviously the core salary, as well as specific health sector allowances, which we will also seek to improve. And we hope that this will be adequate to the satisfaction of the health sector employees. And then finally, as we do this, we will seek to make sure that we stay within our budgeting parameters. We do have the right levels of headroom to be able to accommodate this adjustment, but we'll make sure that we stay within the right levels of headroom so that, again, civil service salaries don't run away. There's a percentage of the revenue that we raise per month. We've done all this kind of analysis, and we'll make sure that we stay within the targets. I think civil servants and government will work closely together to make sure that this happens in their negotiations. I thank you.
All right. Okay.
I think we are done.
I want to thank you very much. I think it has been very clear, the national health care strategy that will certainly ensure all members will be treated equally. I think this is what we have been waiting for, and we want to thank you very much, Honorable Vice President, Minister of Health and Childcare. Thank you.
Can we be indulged for questions, Vice President, please?
Don't we have a lot to ask me further?
Just
Is it not enough?
just a few questions for clarity, Honorable Vice President, please.
Yeah.
Is it about? That's Blessed Mklanga. That's Heart and Soul.
Oh.
Blessed Mklanga, that's his name. And he's coming from Heart and Soul. That's Tuesday.
Okay.
Thank you for your indulgence, Honorable Vice President. I just wanted to find out, you spoke about the export health in terms of patients leaving the country going to get medical care. Will government make a policy to ensure that ministers are the first ones to stay at home and get medical care locally?
When we say there will be no, we will not export our patients, we will not make referrals to our patients. It's everybody. Ministers are only about 20. But those who have been going out, it's you, me, isn't it? All together. That export bill was too high. And that's what we want to curtail. And to do away with that is that we are restructuring from the village, from the village health worker right up to the queenary hospital. And have hospitals which will specialize in different treatments. To say if you want to have your kidneys, sorted out, go to Masvingo General Hospital. If you want to have your liver removed and replaced, go to St. Luke's in Rupani. Do I make myself clear?
Yes,
Thank you very much for your indulgence, Honorable Vice President. Thank you very much.
And once again, I would like to thank you for coming.
That was the question. Are you done?
I can have more. But thank you very much for your indulgence.
Thank you.
Yeah.
Thank you very much,
Okay.
Vice President.
All right.
Remember, we are having a brief for the customers.
Okay, mambo katika